I'm Johan Rashivega, and here we are in our studios in Holyoke Media in One Court Plaza, Holyoke, Massachusetts. And I want to welcome Steve Corbin, who is one of our new producers of podcast that is being made here in Holyoke Media. And it's going to be about something really important for people to know. So this is going to be an extended way of providing a public service to our community. I want to welcome Steve Corbin. Steve, thank you for being here.
No, you're welcome. Thanks for having me. I appreciate it.
So tell us a little bit about the concept and what this podcast that you are creating now here is going to be about.
Okay. Yeah. So the name of the podcast is called Revelation Health, and really the concept behind it is to provide information to consumers about health insurance and healthcare in a way that's easy to understand. I've been in the health insurance industry for 23 years, and it confuses me sometimes. You know, it's always changing, and so what I really like to do is just put it in a way that people can understand. It's the cost of care is become so expensive that if people just don't understand some of the simple things, it could be more costly than it has to be.
Especially when the complications of understanding and navigating so many terms, so many different types of insurance and coverage, and even the eligibility for specific type of conditions, age, the situation if you have a job or not, and the access to all of that becomes something that for many people, even with access to some of these benefits, becomes always a challenge. So how did you found this to be a motivation for you to create this podcast?
So like I said, I've been in the industry for a long time. I started out working with large national carriers, spent about 16 years of my life doing that. And through circumstances, I realized that sometimes big corporate America is just not in the consumers. They're not on the consumer side. You know, it's they're companies and they're there to make money. Yeah, they do want to help, but it's a lot of good people stuck in a bad system, I like to say. So I decided to kind of come out into the broker arena where I could work individually and have multiple choices to help companies. But as I was doing this, you know, I'd have a number of open enrollment meetings where I'm meeting one-on-one with individuals, and I just saw people were struggling. You know, people were struggling to understand it. People were struggling to pay bills. You know, there's a lot going on in life right now. You know, inflation, this, that, whatever it is. I mean, the cost of living is expensive enough, and now we're adding in rising health insurance costs. I mean, a lot of times people are paying $200, $300, $400 a month or more. I mean, sometimes I see it's like, you know, $800 to $1,000 a month for a family plan and that's with the employer paying something. And then they go to the doctors and then they get a bill for $1,000. I mean, I don't know about you, but it is just not a lot of people have $1,000 to pay for a medical bill. And so it just really started weighing on me. And then the more I dove into it, the more I realized it's an epidemic level. The number one reason why people go bankrupt in this country is medical bills. I mean, that's just not right. And so if there's just some little that I can do to help that, I wanted to do it.
And not only for the purpose of help and provide this guidance for people, but also thinking how it has been for you to learn to create this information with your knowledge, your expertise, and your experience, but at the same time, learning how to create it as a podcast.
Oh yeah, it's learning how to deliver a message through the podcast has been amazing, and it actually the way I kind of came about here at Holyoke Media was amazing because I've always liked kind of this type of a venue, like the podcast, right? To deliver media. I've always liked that, but I never knew how to deliver the information. I didn't have the equipment. I'm a little bit of a quasi-perfectionist, so I would never wanted to do it with just like, you know, $100 camera and a $20 mic that I picked up on Amazon. I would always, so I looked into, a few different things. But then I was scrolling through my Instagram feed, and Holyoke Media popped up, and they were talking about how they could help people produce podcasts. And so I reached out and had a few kind of exploratory meetings with some of you guys here. And but now, I mean, it's learning how to use the equipment has been enlightening. It's been pretty exciting. So like I said, it's I'm very excited about having this opportunity to come in here and produce my own podcast. It's been great.
So when we talk about creating a podcast that is going to be dedicated to explain all the different aspects of navigating the health insurance universe, what will be some of the topics that you have already planned to present for the public to know about? What will be other possibilities for people to even maybe consult with you through the podcast about specific topics that are hard to understand or confusing because terms or the process or the way it operates?
Oh, sure. Yeah. So some of the topics that we'll talk about, one of the ones will be just kind of understanding acronyms, right? In this healthcare industry, we just throw out 1,000 acronyms at you on a daily basis. And sometimes I think it's by design to confuse the heck out of you, so you don't know what to do. So I really want to touch base on that. Also want to talk about, we'll be talking about, building relationships with providers. I'm going to have guests in from time to time. We're going to talk about some things newer in the industry that you may not have heard about. Talk about things that you can do yourself to kind of keep you, healthier, right? So, I mean, one of the best ways to avoid medical costs is to avoid medical care. And if there are things that we can be doing to do that, to avoid the care, then that's great. And I'm not saying to avoid it because you can't afford it and you need it. I'm saying just, make yourself feel better, diet, exercise, things like that. So we're going to have some guest speakers coming in and talking about that. I mean, the topics are endless. And if I ever think that I'm running dry on a topic, believe me, the government's going to change something in health insurance. Somebody's going to come out with something new. So we're always going to have great topics to talk about.
Particularly when we are seeing how the recent years, seeing how some people in the government are trying to get rid of the Affordable Care Act and try to institute a different way to operate. So this is also a possible venue to continue discussing how those changes will affect the coverage or the process for some people. So I think it's a source of information, updates, and a way to keep people communicated. And that also brings me to another aspect of what you're doing, because you work on the health insurance environment, and at the same time, you are now creating a new nonprofit. So tell us a little bit about that.
Oh, sure. Yeah. So like I said, I've been in the health insurance industry for a while, and just kind of going back to the answer to one of the previous questions where just seeing people struggling with health related expenses was really just kind of, tugging at the heartstrings, so to speak. So what I decided I wanted to do is just create this nonprofit. So that's what it's established, we're getting it up and running now. We're in that funding stage, but it's called the Kingdom Health Group. And really what we're doing is we're focused on individuals in the Pioneer Valley, working folks just trying to get by that having issues paying off medical debt, right? There's whole criteria on the website. And there'll be some links in the podcast to get to the website and things of that nature. But we're really just focused on, helping working families who have been impacted by medical debt.
What other aspects do you think you will be able to cover or that you envision being able to accomplish by putting this podcast out?
I mean, aside from the education and maybe the awareness, right, that this is a problem. I don't think that's not a secret that medical, debt and medical billing is a problem. But building some local awareness. I hope to have some outreach to some local government, citywide, statewide, to really just advocate for those folks that are out there, that are struggling, and what can we do as, from a government, from a community perspective, to make these impacts. So it's really kind of that grassroots startup to kind of locally make that impact. There are some folks doing things on a national level, but it just seems like every time we move forward, there's a big roadblock. It is big business, and there's a lot of people making a lot of money here. So, but there's got to be a better way. There really does. So I'm hoping to kind of impact things from that way. Another one of kind of my goals is it's a bit of a long-term goal because I think it's going to be something that's going to take some time for us to get there. But through the nonprofit is to open low-cost concierge health clinics. Right? There are these things out there called direct primary care. But they're usually, subscription based. They cost a couple $1,000s a year. And for folks that are kind of struggling, just living paycheck to paycheck, they don't have that. And primary care it's a big problem right now, right? There's a big lack of it. So what I'd like to do is through the nonprofit is to create that in an affordable model while still allowing, physicians, invest a lot. So it's still making sure that we can get quality physicians to take care of folks. But give them access to that concierge level care where they're not going in for an appointment with their primary care physician and they're being escorted out 15 minutes because their time's up, right? They can go in and they can build that relationship. They can get to know that doctor. That's a real long-term goal, but I think that's something that's going to have a real profound impact on people's health and wellness around here.
Well, in the meantime, having this podcast as a way to bring awareness, information, updates for our community to learn, understand better, and take action on matters that are so important for everybody. Our health is basically the maintenance of keeping a healthy and extended life with the best possible quality. So I think this is a really important project and idea, and we are more than glad to have you here with us today because so far, the listening to your sessions, recording the first set of episodes for this podcast are highly informative and easy to understand and access for people.
Yeah, thank you very much. And I mean, thank you guys here for giving me this opportunity. Like I said, I wouldn't be able to deliver this message. I wouldn't be able to reach out to the people that I want to reach out to if you guys here at Holyoke Media didn't give me the opportunity. So thank you guys. I really appreciate it.
So this is Steve Corbin, producer of Revelation Health, a new podcast here in Holyoke Media that is available through our podcast feed. And you can also find it on different platforms of podcast distribution. So Revelation Health and Steve, anything else you would like to add?
No, again, like I said, I mean, just thank you for giving me the opportunity. And stay tuned. Keep listening to the podcast. I guarantee you, you'll be better off for it. You'll be a more educated consumer. You'll understand the industry a little bit better, and you'll be able to better advocate for you and your families when you actually have to access the system. So thank you very much.